very proud of our relationship with American Senior Communities. If you have a senior loved one, then it's always really good information. They've got a number of locations here in town, in and around Wave Country in Kentucky. And with me now is Bobbie Johnson. She is an occupational therapist. Welcome back to the show, Bobbie.
Thank you.
And also Travis Prentice. You're from Hillcrest Village, right?
Yes, sir.
All right. We're talking about outpatient therapy. So first of all, outpatient therapy, what does that mean? Does that mean you guys come in and help them as much as they need, and then you're trying to get them close to 100% and then release, or what does that exactly mean, Bobbie?
Well, outpatient is where the patients come into us, kind of like a doctor's visit or something like that. 2 or 3 times a week, they'll come see us for any of their therapy needs.
Okay, gotcha. And what kind of injuries or conditions are you looking at when you're looking at an outpatient therapy situation?
There's a wide range. We can do cardiac issues, pulmonary issues, orthopedic issues like joint replacements, or chronic pain is the big one that we're focusing on right now. So many people suffer from pain, whether it be generalized or localized. We have a lot of good interventions for people with pain. So.
And Travis, I've noticed with American Senior Communities, each facility has a specialty. So at Hillcrest, one of your specialties is outpatient therapy, correct?
Yes, we have a lot of patients who come in, like you stated before. We get them as close as possible to be functional to return home, but a lot of them still just need a little bit more, and they can use a little bit more therapy. So we bring them in on an outpatient schedule, and we train them, get them back to where they need to be.
Yeah, and I think, this is probably pretty obvious here, but with the growing, everyone's getting older every day, baby boomers and everyone. So I would think this kind of, you talk about rewarding work, helping people get back to 100%, getting active again, probably pretty rewarding for both of you, right?
It is. It's very rewarding. We were talking before the show. The most rewarding is when we've rehabbed them and they come back and they've cooked for us, or they've got gifts or something for us, and we're able to see them walk in, and they're able to share with us how rich their lives are now and how much we were able to help.
Yeah, and American Senior Communities, folks, whenever I have someone on, I can tell that you genuinely care for people. Compassion's a big part of it, isn't it? You can be as educated as you want, but you got to care for people, right, Travis?
Yeah, you got to have compassion, especially to be in the healthcare business, because you're dealing with people when they're at their most vulnerable, and they need you to have some compassion, to educate them, to treat them like a human, give them some dignity, so you can train them to be back to independent folks.
Okay, I'm looking forward to this. Okay, I have not had any kind of preview of this device. This is an MPS unit, correct?
Correct.
Okay, now what does an MPS unit do? When is it needed?
Well, we typically use it with pain. The MPS unit stands for microcurrent point stimulation. It kind of works like a TENS unit. Okay, and it's kind of like with Eastern medicine. It deals with acupuncture. So trigger points.
I see, with trigger points and stimulating those points. So does it redirect the pain, or is it therapeutic?
It's therapeutic. It relaxes that area, and also one of the benefits of it, it releases our body's natural painkiller, which is endorphins.
Okay, sure. Okay, so show me how this thing works.
Okay.
All right, here we go. We're gonna put Bobbie and Travis to work here, ladies and gentlemen.
Okay.
I've got plenty of pain, so.
So Bobbie was a patient of ours, and this is one of the things that we offer with our outpatient. Say she had carpal tunnel syndrome. Okay,
Probably pretty common.
Pretty common. People at the computer all day.
Move this so we can take a good look here. There we go.
So what we do, we take this unit, we turn it on, and what I do is I find the trigger point.
Okay, when you say trigger points, so you've got to know the anatomy pretty well to know where those trigger points are. Right? Yeah.
And when you hear that sound,
Oh, I hear that sound.
that's what I call the dolphin. It sounds like a dolphin communicating. What we would do is we press our button here, leave it on there for about 20 seconds.
That dolphin sound is your friend.
Right. I'll let you know you hit the trigger point, the acupuncture point. And we also do this in coordination with, other modalities, moist heat, cryotherapy, also stretching and strengthening.
Okay, so with this unit, I'll ask you, what other areas is it? He mentioned carpal tunnel. If someone has a knee issue, a shoulder issue, tell me about some of the areas this would be used.
Absolutely. So according to the trigger points and the acupuncture points in the body, if it's a shoulder issue, the funny thing is it may not be the shoulder that you address. It may be a different part of the body, but that region of the body helps to control what's going on, say, in the shoulder. So we would use the dolphin to address those areas, and you'll see pain relief from generalized pain, localized pain, if it's a shoulder, if it's an ankle, if it's a knee. But the good thing is it doesn't only address like pain. You can also use it to address things like gout, COPD, CHF, because all of those systems are linked together in our bodies. So you can use it to treat even constipation or chronic fatigue.
That's
you
right.
know, you can use it to treat a wide variety of conditions.
Interesting. You mentioned Eastern medicine. So this is where this kind of, when we hear things like acupuncture and things like this, is kind of where this originated. It's maybe a little bit more of an advanced, more Americanized version of. So what kind of results have you seen, Travis? I'm curious, does it expedite the healing process? I mean, tell me what you've seen.
Well, pain is subjective.
Right.
We do have patients who come in and say after going through a treatment session with us that they do feel relief in pain. And the good thing about it is that it's simple, it's not invasive. It's a more conservative way to treat pain other than surgery and to get rid of using pain medication.
All right, I like the sound of that. I think a lot of people now with this opioid epidemic that you hear so much about, and it is scary. It's scary. So if you have an alternative, why not give it a shot and see if it helps you? Okay, for those who maybe have a loved one, a senior loved one, and they need outpatient physical therapy. Okay, first step, what do they need to do now? We know Hillcrest deals with that. How many of your facilities here locally could also help them, Bobbie?
I know that two of the three of us do. Hillcrest does, and I know that Riverview Village does. But to get started, you can speak with your doctor and let them know, that you've heard of American Senior Communities and would like, a referral there for outpatient services. You can certainly call Hillcrest Village and ask to speak to Bobbie or anyone in the rehab department, and we can certainly help to get you set up. It's a very easy process. I make it as easy as I can. I just need an order, and I just need, your insurance information, and we call and get you scheduled. Another good thing that we do offer that I don't believe a lot of other companies do is we offer Saturday visits as well. So Monday through Saturday, yes, for those people who can't, work through the Monday through Friday, 8 to 5, we do have that option available. So
again, and let's show the website too, American Senior Communities, and there's all kinds of modern therapies, including this MPSU. Is that what it's called? Make sure I'm right. MPSU. Waiting for the dolphin sound. Correct. And by the way, at Hillcrest, if a fight breaks out, I'm right behind Travis. I'm telling you that. I mean, look at this guy. Look at this guy. All right. Once again, a partner of ours, and we're proud to have them. American Senior Communities, taking care of your senior loved one. Coming up here, Dairy Queen. How would you like a $20 gift certificate? We'll give that away next. Coming on the other side, at Wait 3 Listens, we are live.